We'll now continue our discussion and talk about the different treatment options that are available for cancer. Okay. The main ones that we'll focus on will include the use of surgery, chemotherapy, radiation, as well as something called targeted therapy. In the end, I'll also mention some of the other treatments that are less commonly used, but we'll focus on these main four. Okay, the first being surgery. So surgery is important because it's not only used to treat cancer, but it's also very important when it comes to diagnosing as well as staging cancer. Okay, so the way in which surgery is used to diagnose cancer is through the use of something called a biopsy. So typically, if cancerous growth is suspected, so potentially in a physical exam, you feel the presence of a lump, or potentially in imaging. So you get a mammogram and you can see that there is some sort of abnormal growth. A biopsy could be used to then go in and invasively remove a portion of fluid or tissue and then examine that to see, do you see abnormal cells present? Do you see anything that indicates that this is a cancerous growth? Okay. And once something is confirmed to yes be cancer, biopsies can also be taken of nearby lymph nodes as well as nearby tissues or organs to determine whether or not that cancer has spread. Okay, and that's important when it comes to cancer staging, because usually stage 1 cancer is where the cancer is only present at that primary site, and then the more advanced staging is when that cancer has started to spread, and sort of how far has it spread. And so biopsies are very important when it comes to that. Okay, surgery is also used very effectively when you catch cancer in its earliest stage. So going in and using surgery to remove the cancerous growth, like I said, can be highly successful when that cancerous growth is limited to that primary tumor. Okay? Once it has spread beyond that original site, surgery is going to be less effective because you're going to be unable to go in and remove every single abnormal cell that's present. Okay? Surgery can also be used surgery can also be used palliatively, and this means that it's used not to treat the cancer itself, but to help to alleviate some of the symptoms caused by tumor growth. And we'll see this when we talk about pancreatic cancer, where sometimes going in and removing the pancreas can be the pancreas is an important organ, so going in and removing that might not be an option. And so there's different types of surgery that could be used to alleviate the symptoms caused by, that primary tumor growth. They might be causing pain, they might be disrupting normal organ function, and so surgery might be used to help alleviate those symptoms. In combination with therapy or other cancer treatments, chemotherapy is commonly used. And chemotherapy uses chemotherapeutic drugs that are able to target and destroy any proliferating cells. And so you can see that this is going to have the caveat that while it's going to be very effective at killing these abnormally growing cancer cells, it could also harm healthy cells, so any cells in your body that are growing and dividing quite quickly. These include all of the cells that line your mouth and intestines, as well as those that are responsible for hair growth. And so one of the most common side effects that you see from chemotherapy is that hair loss. So as you're taking these drugs, they're going to be very effective at killing any kind of proliferating cells. So hopefully you're getting rid of all of those cancerous cells, but you're going to have these severe side effects because you're going to be harming healthy cells. Okay. Chemotherapy is going to be used for a number of different ways. Some chemotherapy can be very effective in curing cancer. So chemotherapy is so effective it's going to go in and destroy all of those cancerous cells to the point where you no longer can detect them, and they're no longer going to be able to grow back. Chemotherapy is also used just to control the cancer itself. So chemotherapy can stop those cancer cells from growing and dividing in a way that will cause it to continue to spread. It can also slow its growth, so it might not be able to get rid of every single cancerous cell, but it can slow the overall progression of the disease. And it can also help to destroy those cancerous cells that have spread to different parts of the body. Because remember, we just talked about surgery. Surgery can be very effective when you go in and remove that primary tumor, but once some of those cells have moved from that primary site and spread to other tissues or organ systems, chemotherapy can then be effective to sort of seek out those cells and destroy them. Okay. It can also be used again in this palliative way, where it's going to just ease cancer symptoms. So if you have all of these different tumor sites that are, the cancer has spread, it's caused tumors in different sites of the body, chemotherapy can sort of ease those symptoms by causing those tumors to shrink, potentially, when they're causing pain or pressure. So, taking chemotherapy drugs might not be at the point where you can cure the cancer, but it can help prolong life. It can help also increase the quality of that life. Okay, and there's 100 different types of different chemotherapy drugs that are available, and the specific drugs are going to be very dependent on the type of cancer in which you have, how far advanced that cancer is, and whether or not you have previously received a chemo treatment. And these are very important for a number of different reasons. So some specific drugs have been shown to be much more effective against particular types of cancers, as well as you might be given a cocktail of different chemotherapy drugs. So you might get 2 or 3 or 4 different drugs in combination, because those have been shown to be very effective against the type of cancer that you might have. As well as, depending on how far advanced your cancer is, again, different drugs will be more effective. If you've already received a cancer treatment, it might be that those cells will no longer be as susceptible to previous treatments you've received, so you might now receive a different course of chemotherapeutic drugs. Okay? And chemotherapy can be delivered in a bunch of different ways. It can be given as an injection, it could be given through IV treatment, as well as it might be something that you take orally in pill form. And again, the duration of the treatments, the frequency of them, that's all going to depend on the very specific type of cancer that you have. Okay. Radiation therapy is another very important type of cancer treatment that uses high energy in the form of X-rays, gamma rays, or charged particles to shrink tumors and kill cancer cells. And the way in which radiation therapy works is that it causes damage to cancer cells by going in and damaging the DNA to a point where it can no longer be repaired. Okay, and this is going to happen both directly by radiation directly causing that DNA damage, or by promoting the production of free radicals like those reactive oxygen species and those electrophiles we previously talked about, which will then cause DNA damage. Once a cell has its DNA damaged beyond its ability to repair it, that cell is then going to stop dividing and die. And those damaged cells will then be removed from the body through natural processes. Okay, so radiation can be delivered typically through the use of an external beam. And this means that an individual will, you can see here, be sort of lie down near this machine. And then this beam of radiation will be very precisely delivered to the site of the primary tumor. So again, a doctor and your medical team will map out exactly where was that primary cancerous growth, and then where should we precisely deliver that radiation beam. Okay? And it's really important because we just talked about how radiation causes DNA damage and causes cells to, arrest and then die off. And so you don't want to be delivering, you want to minimize the amount of radiation that would reach healthy cells where it could potentially cause, unwanted cell death or DNA damage in those otherwise healthy cells. Okay, so radiation can be delivered externally, as you see here, through the use of a machine, or also internally through the use of low and high dose implants. So these implants will be put internally near that primary tumor site, where they'll be able to deliver that radiation in very close proximity to those cancerous cells. Okay? And then for some types of cancer, you can actually deliver radiation internally in liquid form, where it's not going to go as precisely to a specific site. Okay? It's important to note that there is a major difference between chemotherapy and radiation. Radiation is going to be used to treat that primary tumor, whereas chemotherapy has the ability to treat cancer once it has spread. Okay, so because radiation is always delivered in a very precise and targeted manner, you're going to miss any of those cells that have spread beyond that primary tumor site. So a lot of times chemotherapy and radiation are going to be used in combination with one another. Okay, and this is again going to depend on the type of cancer that you have and what stage it is being treated at. The other major type of cancer treatments are called targeted therapies. And targeted cancer therapies, these are going to be drugs or other substances that block the growth and spread of cancer by interfering with specific molecules or molecular targets that are involved in the growth, progression, or spread of that particular cancer. And so targeted therapies can be very effective because one, these drugs will just go after particular molecular targets in a subset of proliferating cells, meaning you could target those cancerous cells and hopefully spare healthy cells that are present in the body. As well as they have the ability, again, to not only treat at the particular site, but also go after these cells once they have spread to other sites in the body. Okay, so it's not just going to be limited, to that primary tumor site. It can sort of wholly treat the presence of those cancer cells anywhere once they have spread. Okay, and I'll give you an example, but do know that there are hundreds of these targeted therapies now approved, and there are more and more being developed every day as scientists understand what makes, liver cancer cells quite different than breast cancer cells, different than colon cancer cells, and identifying more of these targets and then designing drugs that go after them. Okay, so one I'll talk about involves HER2, what's known as HER2 positive breast cancer, and a drug called Herceptin. So about 1 in 4 or 1 in 5 cases of breast cancer are said to be HER2 positive. Okay, HER2 stands for human epidermal growth factor receptor 2. So this is a protein that's going to be present on the outside of the cell that's important when it comes to telling that cell when it should be growing and dividing. So in individuals with the HER2 positive breast cancer, what they have is too much of this HER2 protein present on the outside of their cells, so on their cell surface. When you have too much of this, what it's doing is it's initiating these cells to grow and divide abnormally. Okay, so again, HER2 positive breast cancer, and you also do see HER2 positive cells in other types of cancer, but significantly in breast cancer. It has this receptor sort of malfunctioning. You have too much of it present on the cell surface, and it's causing these cells to grow and divide. Okay. The other thing that's important to note is that HER2 positive breast cancer or other types of cancer are known to be quite aggressive. Having this overexpression of this growth factor on the cell surface causes these cells to grow and spread quite rapidly, and it's actually it's a quite difficult cancer to treat. And so this led to the development of Herceptin, which is it's actually a monoclonal antibody that interferes specifically with the HER2 receptor and blocks its ability to induce cell proliferation. Okay, so individuals that have been diagnosed with breast cancer and then that breast cancer has been found to be HER2 positive, they can then receive this treatment, which is Herceptin, so a monoclonal antibody that will then specifically cause those cells, will specifically go in and repress those cells from growing and dividing as fast as they were. Okay, so Herceptin is going to be a very targeted treatment to cancer cells that just have this receptor present at higher amounts on their cell surface. Okay, and you can sort of see in this image here, so without Herceptin, so if you're not taking the drug, you're going to have that HER2 receptor on the outside of those cancerous cells, and that's going to be sending these signals to the cell. Okay, let's continue to grow and divide. Let's grow quite rapidly. When you're now taking Herceptin, you're going to have these antibodies present that are going to bind to the HER2 receptor and then flag them for destruction by the immune system, as well as it also has the caveat of binding to those receptors and blocking that downstream signaling. So saying, okay, let's stop that cell proliferation. Okay, so again, it's a very, very targeted therapy. It's not just a chemotherapeutic drug that's going to, you're going to take and hope that it kills, cancer cells because it's killing everything that's growing and dividing. It's very specifically going after cancer cells that have that HER2 receptor present on their cell surface, and what it's going to be that receptor and the downstream processes it modulates that cause those cells to be growing and dividing very fast. Okay, so that's going to be the specific example of a targeted therapy, but just know that there's more and more examples of this that are being developed and coming to market every day. So the more that you can sort of characterize and understand the specific type of cancer that you have, the better able you are to treat it with specific drugs that can be targeted against what's causing those cancer cells to grow and divide abnormally.